The 𝙏&𝙏-𝙏-𝙏 Children's Hospital, Honoring Transformational Vision, an editorial by Professor Wall Street. Why Trinidad and Tobago's first female prime minister deserves this historic recognition. The 𝙏&𝙏 Children's Hospital stands as one of the most significant healthcare achievements in Trinidad and Tobago's history, representing a transformational leap in pediatric care that will benefit generations of children. As this world-class facility prepares to serve our nation's most vulnerable citizens, the question of its naming becomes not just ceremonial, but deeply meaningful. There is no more appropriate honor for this institution than to name it after Prime Minister 𝙏&𝙏-𝙏-𝙏, whose visionary leadership during her first administration from 2010 to 2015 conceived, planned, and initiated this groundbreaking project. The naming of public institutions should reflect the contributions of those whose vision and determination brought them into existence. In the case of the 𝙏&𝙏 Children's Hospital, that vision belongs unequivocally to Prime Minister 𝙏&𝙏-𝙏, whose transformational thinking recognized that Trinidad and Tobago's children deserved world-class specialized medical care delivered in a state-of-the-art facility designed specifically for their needs. This is not merely about political recognition. It is about historical accuracy, acknowledging transformational leadership and ensuring that future generations understand who had the courage and vision to prioritize children's health care when others might have chosen different paths. The 𝙏&𝙏-𝙏-𝙏 Children's Hospital would serve as a permanent reminder of what visionary leadership can accomplish when it focuses on the well-being of our most precious citizens, our children. Here are 10 reasons why the hospital should bear Prime Minister 𝙏&𝙏-𝙏's name. 1. Original vision and conception. Prime Minister 𝙏&𝙏 was the architect of the vision for a dedicated children's hospital in Trinidad and Tobago. During her first administration, she recognized that the nation's children required specialized pediatric care that could only be delivered through a purpose-built facility designed specifically for young patients. This wasn't an inherited project or a continuation of previous plans. It was her original conception, born from her understanding that healthcare infrastructure must evolve to meet the specific needs of different populations. 2. Transformational healthcare thinking. The decision to build a specialized children's hospital represented transformational thinking about healthcare delivery in Trinidad and Tobago. Rather than simply expanding existing facilities or maintaining the status quo, Prime Minister 𝙏&𝙏envisioned a fundamental shift towards specialized, patient-centered care. This forward-thinking approach recognized that children are not simply small adults. They require different medical approaches, different environments, and different care philosophies. 3. International partnership and collaboration. Under Prime Minister 𝙏&𝙏's leadership, the project was developed through international partnerships that brought world-class expertise to Trinidad and Tobago. Her administration's ability to negotiate and secure these collaborations ensured that the hospital would meet international standards and incorporate best practices from leading pediatric institutions worldwide. This diplomatic and strategic achievement deserves recognition through the hospital's naming. 4. Historic significance as first female Prime Minister. As Trinidad and Tobago's first female Prime Minister, 𝙏&𝙏 broke barriers and opened doors for future generations of women in leadership. Her role in creating the Children's Hospital reflects the caring, nurturing approach often associated with maternal leadership. making her connection to a children's facility particularly meaningful. Naming the hospital after her would honor both her specific contribution to this project and her historic role in our democracy. 5. Investment in future generations. The Children's Hospital represents a profound investment in Trinidad and Tobago's future, and Prime Minister 𝙏𝙏𝙏𝙏-𝙍𝙬𝙤 vision ensured that future generations would have access to world-class pediatric care. This long-term thinking and commitment to children's well-being reflects the kind of leadership that deserves permanent recognition. The hospital will serve children for decades to come, making it fitting that it bear the name of the leader who prioritized their healthcare needs. 6. Overcoming political and bureaucratic obstacles. The creation of a major healthcare facility requires navigating complex political, bureaucratic, and logistical challenges. Prime Minister 𝙏𝙏𝙏-𝙍𝙬𝙤's administration successfully overcame these obstacles, securing funding, approvals, and international partnerships necessary to move from concept to construction. This administrative and political achievement represents the kind of effective leadership that transforms ideas into reality. 7. Setting new standards for healthcare infrastructure. The Couva Children's Hospital has set new standards for healthcare infrastructure in Trinidad and Tobago and the wider Caribbean region. Prime Minister 𝙏𝙏𝙏-𝙍𝙬𝙤's vision for this facility raised the bar for what public healthcare facilities could and should be, inspiring higher expectations for medical infrastructure throughout the region. This standard-setting achievement deserves recognition through the hospital's naming. 8. Commitment to public healthcare. At a time when many leaders focus on private healthcare solutions, Prime Minister 𝙏𝙏𝙏-𝙍𝙬𝙤's vision for the Children's Hospital demonstrated unwavering commitment to public health care accessible to all citizens, regardless of economic status. This dedication to healthcare equity and universal access reflects values that should be permanently associated with the facility through its naming. 9. Regional healthcare leadership. The Children's Hospital has positioned Trinidad and Tobago as a regional leader in pediatric healthcare, attracting patients and medical professionals from throughout the Caribbean. Prime Minister 𝙏𝙏𝙏-𝙍𝙬𝙤's vision extended beyond national boundaries to create a facility that serves the broader Caribbean community. This regional leadership and the international recognition it has brought to Trinidad and Tobago merits acknowledgement through the hospital's naming. 10. Enduring legacy and inspiration. Naming the hospital after Prime Minister 𝙏𝙏𝙏 would create an enduring legacy that inspires future leaders to think transformationally about public service and healthcare. Young people visiting the Kamla 𝙏𝙏𝙏 Children's Hospital would learn about the leader whose vision created this facility, potentially inspiring them to pursue careers in healthcare, public service, or leadership roles where they too could make transformational contributions to society. The precedent for honoring visionary leaders. Throughout the world, major public institutions bear the names of the leaders whose vision brought them into existence. This practice recognizes that transformational public works require transformational leadership, and that such leadership deserves permanent acknowledgement. The Couva Children's Hospital represents exactly the kind of visionary public investment that warrants such recognition. Moreover, naming the hospital after Prime Minister 𝙏𝙏𝙏 would establish an important precedent in Trinidad and Tobago for recognizing transformational leadership regardless of political party affiliations. Future leaders would understand that true vision and effective public service will be remembered and honored, encouraging higher standards of leadership across the political spectrum. The educational value. The 𝙏&𝙏-𝙏-𝙏-𝙍𝙬 Children's Hospital would serve as an educational tool, teaching future generations about transformational leadership and the importance of investing in children's well-being. Medical students, nursing students, and healthcare professionals training at the facility would learn not just clinical skills, but also lessons about visionary leadership and public service commitment. This educational dimension extends beyond healthcare to broader lessons about democratic leadership, gender equality, and the importance of long-term thinking in public policy. The hospital's name would spark conversations and learning opportunities that extend far beyond its medical mission, addressing potential concerns. Some might argue that naming the hospital after a political figure could be seen as partisan. However, this concern misunderstands the difference between political recognition and recognition of a transformational public service. Prime Minister Persaud Bisesa's role in creating the Children's Hospital transcends party politics. It represents effective public service that benefits all citizens, regardless of their political affiliations. The hospital will serve children from every community, every ethnic group, and every political background. Its naming should reflect the inclusive vision that brought it into existence, and Prime Minister Persaud Bisesa's leadership represented exactly that kind of inclusive, transformational thinking. The Mother of the Nation connection. As Trinidad and Tobago's first female Prime Minister and the visionary behind the Children's Hospital, Prime Minister Persaud Bisesa has earned recognition as a true mother of the nation. Her maternal approach to leadership, particularly evident in her prioritization of children's healthcare, makes the connection between her name and a children's hospital both natural and meaningful. This maternal leadership style, which prioritizes care, nurturing, and investment in future generations, represents values that should be permanently associated with an institution dedicated to healing and caring for children. In conclusion, a fitting tribute to transformational vision. The Couva Children's Hospital exists because Prime Minister Kamla Persaud Bisesa had the vision to imagine it, the determination to plan it, and the leadership skills to make it reality. Her transformational thinking recognized that Trinidad and Tobago's children deserved world-class health care delivered in a facility designed specifically for their needs. Naming this remarkable institution the Kamla Persaud Bisesa Children's Hospital would honor not just a political leader, but a transformational figure whose vision will improve the lives of countless children for generations to come. It would recognize the historic significance of our first female Prime Minister while celebrating the maternal leadership that prioritized children's well-being above political considerations. This naming would create an enduring legacy that inspires future leaders to think transformationally about public service, encourages young people to pursue careers in healthcare and public service, and permanently associates Trinidad and Tobago with innovative healthcare leadership. The children who will be healed, treated, and cared for in this facility deserve to know whose vision created this sanctuary of healing. They deserve to learn about the leader who believed they were worth the investment, the planning, and the international partnerships necessary to create world-class pediatric care in Trinidad and Tobago. The Kamla Persaud Bisesa Children's Hospital would stand as more than a healthcare facility. It would be a monument to transformational leadership, maternal care, and the belief that every child deserves the very best health care our nation can provide. This is the fitting legacy for a leader whose vision transformed an idea into a reality that will serve our children for generations to come.